I'll never forget the moment I got that phone call. It was my old friend Richard, a retired school principal from Ohio, someone I've known for over 30 years. His voice was weak. He had just been discharged from the ER after days of confusion, nausea, and a strange heart rhythm. What shocked me most wasn't just his condition, it was the cause. Richard had been taking high-dose vitamin D supplements, 10,000 IU every day for nearly 6 months, thinking it would boost his bones as he aged. He read about it online. No doctor, no blood test, just blind trust in a bottle. What he didn't know is that the safe upper limit recommended by the NIH is only 4,000 IU day. And according to the Cleveland Clinic, long-term overdose can cause calcium buildup in the blood, leading to kidney damage, arrhythmias, and even hospitalization, just like what happened to him. This is not just Richard's story. Across the U.S., vitamin overuse is silently harming older adults who are trying to stay healthy but lack proper guidance. Many older adults believe that taking more vitamins automatically means better health. But the truth is, too much of certain vitamins can actually do more harm than good. From liver damage to nerve problems, kidney stones to internal bleeding, overdosing on supplements is a growing but often overlooked danger, especially in those over 60. That's why today, we're going to walk you through 5 specific vitamins that can become dangerous or even life-threatening when taken in excess, particularly for seniors. So grab a seat, take notes if you need to, and welcome to Senior Life, the channel where we bring you science-backed advice, real-life stories, and simple steps to help you live stronger, longer, and safer. What are we waiting for? Let's dive right in and explore 5 vitamins that can be dangerous for people over 60 if taken in excess. The first vitamin that can negatively affect senior health is vitamin A. Most people don't realize this, but taking too much vitamin A after age 60 could quietly wreck your liver, thin your bones, and even increase your risk of fractures by over 100%. Now let's break that down. In my practice over the decades, especially with my older patients, I've seen a common pattern: people take vitamins because they want to stay healthy, not realizing that more isn't always better. Vitamin A is one of the easiest vitamins to overdose on, particularly in the elderly. Why? Because it's fat-soluble, which means it gets stored in your liver and fat tissues. It doesn't flush out like vitamin C or B complex. According to the National Institutes of Health, NIH, the recommended daily allowance RDA for adults over 50 is 900 mcg RA retinol activity equivalents for men and 700 mcg RA for women. But the upper limit, UL, the absolute maximum you should take is 3,000 mcg chow day, or about 10,000 tao's IU. Now here's the kicker. Many supplements contain 5,000 to 25,000 IU of retinol per capsule. That means just one pill could push you to dangerous levels, especially if you're also eating fortified cereals, dairy liver, or taking a multivitamin on top. Let's look at what the Harvard Th. Chan School of Public Health found long-term intake of high-dose preformed vitamin A retinol is linked to a significantly increased risk of hip fractures in older women. In one large study of over 72,000 postmenopausal women, those with the highest intake had nearly double the risk of breaking a hip. And this isn't just about bones. The CDC and Mayo Clinic both warn that chronic excess vitamin A intake can lead to liver toxicity, hair loss, blurred vision, dry or peeling skin, intracranial pressure changes, which can mimic a brain tumor. I had a patient, Robert, 69, from Oregon, who was taking 2 different supplements for his vision and skin health. Both contained retinol palmitate. His blood tests showed elevated liver enzymes, and he was experiencing pressure headaches. We removed the supplements, rechecked his labs after 8 weeks, and his liver numbers dropped back into the safe range. Here's another important point for older adults. Aging reduces liver metabolism. That means the body has a harder time clearing excess vitamin A, leading to accumulation even at moderate doses. If you're middle-aged and prepping for a healthy retirement, this is your chance to get ahead of the curve. So what should you do instead? Get your vitamin A from food, sweet potatoes, carrots, spinach, kale, and cantaloupe are all rich in beta-carotene. Avoid supplements with high doses of retinol palmitate or retinol acetate. These are the most dangerous for liver overload. Check your multivitamin label. If you're getting over 2,000 IU/day of retinol and also eating fortified foods, it's time to scale back. Talk to your doctor about your liver health and bone density, especially if you've had fractures, joint pain, or liver concerns. Ask for a serum vitamin A test if you suspect you've been overdoing it. It's a simple blood draw. The second potentially dangerous vitamin for seniors is vitamin D. I've seen this countless times in my own clinic. Seniors come in convinced they're doing the right thing. They've heard that vitamin D supports bones' immunity and even mood, which is true. But here's the critical detail. More is not always better, especially as we age. According to the National Institutes of Health, NIH, the recommended dietary allowance, RDA, for adults aged 51-70 is 600 IU/day 15 mcg. For adults over 70, it increases slightly to 800 IU/day 20 mcg, but the upper tolerable limit UL, meaning the highest daily amount considered safe, is $4,000 IU/day 100 mcg. Now here's where the problem begins. Many over-the-counter supplements, especially those labeled immune support, contain $5,000 to $10,000 IU of vitamin D per serving. And people are taking these daily for months without ever checking their blood levels. I've had patients combine these with fortified foods, multivitamins, and calcium D chews, not realizing they were stacking up way beyond safe levels. What happens when that line is crossed? A 2021 report from the Mayo Clinic proceedings showed that vitamin D toxicity, once considered rare, is now a growing clinical problem. Their review found that even healthy people can develop hypercalcemia, high calcium in the blood, when their vitamin D levels rise above 100 ng/ml. In fact, in one observational study by the Endocrine Society, patients who consistently took over 10,000 IU/day for 3 to 6 months experienced a 15–25% increase in kidney stone risk, elevated calcium levels in 8 to 12 weeks, fatigue, nausea, constipation, and even confusion due to mineral imbalances. And here's something sobering. According to the Cleveland Clinic, vitamin D toxicity can lead to calcification of arteries, where excess calcium builds up and hardens the blood vessels. This can increase the risk of arrhythmias, irregular heartbeat, heart attacks, permanent kidney damage. So what should you do to stay safe? Here's my practical advice from one experienced doctor to you. Always test before you supplement. Ask your doctor for a 25-hydroxyvitamin D blood test. The ideal range 30–50 ng/ml. Anything above 60–70 ng/ml without medical supervision is risky. Keep your daily dose under 4,000 IU. Unless your doctor tells you otherwise, for deficiency, corrections stick to 1,000 or 2,000 IUs. Day. That's enough for most older adults in the US. Know your sources. Fortified dairy cereals, plant-based milks, and even orange juice often have added vitamin D. So if you're eating these regularly, adjust your supplement accordingly. Watch out for combo pills. Many calcium plus D3 tablets push your intake higher than you think, especially if taken twice daily. Sunlight is still your friend. Just 15–30 minutes of midday sun exposure on your arms and legs a few times a week can help maintain your levels naturally without risking overload. The third potentially harmful vitamin for seniors is vitamin E. Taking vitamin E while on blood thinners might seem harmless, but research shows it could increase your risk of internal bleeding by up to 69%, and you might not even feel it happening. As a physician who has worked closely with older adults for more than 40 years, I can tell you this is one of the most overlooked interactions in senior health. A lot of patients over 60 take vitamin E because they read it supports heart health or immune function. But what they don't realize is it can quietly interfere with blood clotting, especially if they're already on medications like warfarin, aspirin, or Plavix. Let's break down the facts. How much is too much? According to the National Institutes of Health, NIH, the recommended dietary allowance RDA for adults is only 15 mg per day, about 22 IU. The tolerable upper intake level, UL, is 1,000 mg per day, about 1,500 IU of natural vitamin E, or 100 IU of synthetic. That might sound like a high ceiling, but problems can happen even at much lower levels if you're on blood thinners. In fact, a Harvard Health Publishing review warned that doses as low as 400 IU day can begin to increase bleeding risk, particularly when combined with medications that already thin the blood. In a 2005 meta-analysis published in the Annals of Internal Medicine, researchers found that vitamin E supplements of 400 IU or more per day were associated with a higher all-cause mortality in older adults, increased risk of hemorrhagic stroke, bleeding in the brain. In another study from the Journal of the American Medical Association, JAMA men taking high-dose vitamin E for prostate health had a 17% increased risk of stroke, primarily due to bleeding complications. One of my longtime patients, Harold, 78, from Kansas City, had been on warfarin for years after a mild stroke. He started taking 600 IU of vitamin E daily after watching a YouTube video that said it would boost circulation. Within weeks, he developed large bruises on his arms and a spontaneous nosebleed that wouldn't stop for nearly an hour. When we tested his INR, a measure of blood thinning, it had jumped to 4.2, putting him at serious risk for internal bleeding. We immediately stopped the supplement and adjusted his medication. He was lucky, but many others aren't. Vitamin E, especially the alpha-tocopherol form, inhibits platelet aggregation, meaning it reduces your blood's ability to form clots. This may be helpful in small natural doses, but when combined with prescription anticoagulants, it's like removing the brakes from a moving car. Your body becomes unable to stop even minor internal bleeds. This risk is especially high in seniors over 65, people with atrial fibrillation, stroke survivors, anyone taking blood thinners, including low-dose aspirin. According to the Cleveland Clinic, combining high-dose vitamin E with blood thinners can dangerously increase your risk of gastrointestinal and cerebral bleeding, and it's often overlooked by both patients and non-specialist providers. How do you recognize something's wrong? Early signs of vitamin E-related bleeding include easy bruising, bleeding gums, frequent nosebleeds, black or tarry stools, GI bleeding, dizziness, fatigue or shortness of breath from hidden blood loss. If you notice any of these symptoms, especially while on blood thinners, it's critical to see your doctor immediately. What can you do instead? Here's what I tell both my senior patients and younger adults planning ahead. Always tell your doctor if you're taking any supplement, especially vitamin E, even if it seems natural. Avoid high-dose supplements. Most people meet their needs through diet. Supplements over 200, 400 IU day should be avoided unless medically necessary. Get vitamin E from real food: almonds, sunflower seeds, avocados, spinach, Olive oil. These foods provide vitamin E in safe, bioavailable forms with other helpful nutrients. Check your multivitamin labels. Some heart health or anti-aging formulas sneak in large doses of vitamin E. If you're on warfarin, monitor your INR regularly and ask your doctor before adding any supplement. Let me ask you something. Are you taking aspirin or any blood thinner without realizing it? Interacts with vitamin E. Do you check the amount of vitamin E in your daily supplements, or just assume it's safe? In the number 4 spot, niacin, vitamin B3. Let's unpack what's really going on with niacin, also known as vitamin B3. While it's true that niacin plays a key role in energy metabolism, DNA repair, and heart health, the problem starts when people go beyond natural food-based doses. And that happens a lot, especially in older adults trying to self-manage cholesterol. According to the NIH Office of Dietary Supplements, the recommended dietary allowance (RDA) for adults is 16 mg per day for men, 14 mg per day for women. The tolerable upper intake level (UL) is 35 mg per day, but only for nicotinic acid due to the risk of flushing and other side effects. So why do many supplements contain 500 mg to 2,000 mg of niacin per dose? Because high-dose niacin has been used especially in the past as a cholesterol-lowering agent. It can raise HDL, good cholesterol, and lower LDL and triglycerides. But what most people don't realize is that these doses are pharmaceutical level and must be supervised by a doctor with regular liver monitoring. A landmark study published in the New England Journal of Medicine 2014 evaluated over 25,000 high-risk heart patients taking extended-release niacin 2,000 mg per day with a statin. The results: no significant benefit in reducing cardiovascular events, 17% increase in serious side effects, including liver inflammation, gastrointestinal bleeding, diabetic complications, skin rashes, and ulcers. According to the Cleveland Clinic, high-dose niacin can cause hepatotoxicity, liver damage, peptic ulcers, worsening of insulin resistance in diabetics, sudden drops in blood pressure. The Mayo Clinic also warns that niacin, particularly in doses above 100 mg, may trigger headaches, dizziness, skin flushing that can last over 30 minutes, nausea, and stomach irritation. These side effects are especially dangerous in older adults whose liver function, blood pressure regulation, and gastrointestinal lining may already be compromised. One of my patients, Linda, 72, from Austin, Texas, read online that niacin naturally lowers cholesterol. She bought a sustained release product from her local health store, 1,500 mg per tablet. She took it daily unsupervised for nearly 3 months. Then she started experiencing hot red skin on her neck and chest, headaches that wouldn't go away, fatigue, sharp pain under her right ribs. Her liver enzymes came back nearly 4 times higher than normal, and she was pre-hospitalization for niacin-induced hepatitis. We discontinued the supplement, started liver support, and within 8 weeks her numbers returned to normal. She had no idea a vitamin could do that kind of damage. Here's what I recommend for seniors and middle-aged adults alike. Never take high-dose niacin without a doctor monitoring your liver. If your provider prescribes it, they'll need to test AST, ALT, and bilirubin every few months. Stick to food-based sources of niacin. They're safe and sufficient for most. Chicken breast 10 mg per serving, tuna 11 mg per serving, turkey, brown rice, mushrooms, peanuts. Avoid flush-free or time-release niacin supplements unless prescribed. These may reduce the flushing, but increase liver strain. Be cautious if you have diabetes, ulcers, or low blood pressure. Niacin can worsen all 3 even at mid-range doses, if you're taking it for cholesterol talk with your cardiologist. Today's standard of care often favors statins or PCSK9 inhibitors, which are more effective and safer when monitored correctly. Coming in at number 5, vitamin C. Yes, it's essential for collagen production, immunity, iron absorption, and healing wounds. But that doesn't mean taking more will give you extra protection. In fact, high doses can quietly cause more harm than good, particularly for older adults and those with underlying kidney issues. How much vitamin C do we really need, according to the National Institutes of Health, NIH? The recommended dietary allowance, RDA, for adults is 90 mcd for men, 75 mcd for women. Smokers are advised to get plus 135 mg day more due to increased oxidative stress. The tolerable upper intake level UL, meaning the highest daily amount considered safe, is 2,000 mg day for adults. And yet, many popular effervescent tablets, powdered immune boosters, and chewable supplements contain 1,000 megabytes per serving, some even more. It's not unusual for people to take 2 or 3 a day, pushing them far beyond the safe range. A study published in the JAMA Internal Medicine 2013, which followed over 48,000 men for more than 10 years, found that men who took more than 1,000 mg day of vitamin C supplements had a 41% higher risk of developing kidney stones. The reason vitamin C breaks down into oxalate in the body, which binds to calcium in the urine, forming calcium oxalate stones, the most common type. That's not a small increase. And it becomes especially concerning for men over 60, those with mild kidney dysfunction, anyone with a history of stones or dehydration. Meanwhile, the Mayo Clinic and Harvard Health both caution that excess vitamin C can also lead to diarrhea, nausea, cramps or bloating, false positive blood sugar readings in diabetics, impaired iron metabolism in people with hemochromatosis, a condition where the body stores too much iron. Here's my advice. Whether you're in your 60s or planning ahead in your 40s or 50s, don't exceed 500 day without medical supervision. For daily use, 250 mg is enough if your diet is balanced. Get your vitamin C from food. It's safer, better absorbed, and comes with fiber and other antioxidants. Un medium orange, 7 cebulicarm, 1 cup strawberries, 85 mg, 1 cup broccoli, 80 mg, 1 bell pepper, 95 cinnamon. Avoid immune-boosting hype. There's no proof that high-dose vitamin C prevents colds or infections. At best, it may slightly reduce duration. Drink plenty of water if you take any vitamin C supplement. This helps dilute oxalate levels in the urine. If you've ever had a kidney stone, especially calcium oxalate stones, talk to your nephrologist before using any vitamin C product. When it comes to vitamins, even the ones we think are safe, the risks can sneak up on us. Too much vitamin A can hurt your liver and bones. High-dose D might damage your kidneys. Vitamin E can silently increase your bleeding risk, especially if you're on blood thinners. Niacin may lower your cholesterol, but at a cost ulcers, liver strain, and sudden drops in blood pressure. And even vitamin C, when overused, can bring on kidney stones and gut trouble. So here's the truth. Just because it's a vitamin doesn't mean it's harmless, especially after age 60. Your body changes, and so should your approach to supplements. Now's the time to take a fresh look at your medicine cabinet. Read those labels. Ask questions. Talk to your doctor, not Google. And please, don't self-medicate with megadoses. You deserve real answers and safe solutions. If this episode opened your eyes, go ahead and share it with someone you care about, and subscribe to Senior Life for more clear, honest health advice from a doctor who truly cares. We're here for you every step of the way.